Hello, my name is Ben O'Donnell and I am researching, can a TBI be cured by using improvements in today's medical field? In order to answer that question, we need to know the effects of a TBI on a human. Some experts say that the first symptom is ignorance. This means that the soldier may not know he or she has a TBI and may be cleared as fit for duty. The first actual symptom is changes in behavior, i.e., a once normal soldier with normal behavior may act depressed or even have suicidal thoughts or actions. But some commanding officers, or COs, may miss this because he or she may think the soldier is just homesick and wants to be somewhere else. Like I said before, a soldier that is affected by a TBI may experience depression. This depression may lead to suicidal thoughts and actions. But if the CO catches the depression symptoms and knows that the soldier was in an accident or wounded recently, the soldier may be checked for a TBI and either sent home or moved to a hospital for treatment. A soldier affected by a TBI may also be affected by PTSD, and this can have a severe effect on the soldier and may ultimately cause serious problems with his or her psyche, from which the soldier may not recover and leave him or her scarred for life. As many people already know, there is a staff sergeant in Afghanistan who allegedly went AWOL, or away without leave. He ended up killing 17 unarmed civilians in the middle of the night and tried to burn them. In the United States military, going away without leave is a serious problem and will be treated with strict discipline. TBI patients may also experience flashbacks of what they remember, and they may also experience nightmares, or they will forget the whole ordeal. But with improvements in today's head protection, the number of concussions and other trauma that causes TBI has gone down severely. The next part in answering my research question is to understand the overall effectiveness of treatments for a TBI. The first treatment is surgery, and this may be somewhat effective, but in most cases the wounded soldier still suffers from a TBI. But in retrospect, the surgery is not meant to cure the TBI, but is meant to keep the soldier alive. Most TBI victims are given a CAT scan or an MRI to see the overall damage of the wound. This helps identify whether or not the soldier has a TBI, and identifying the TBI early on will help the soldier and his or her comrades. The next treatment method is rehab, and during a soldier's rehabilitation process, he or she may learn things like walking and reading. The rehab process may take months or years to complete, but this can be an effective way to help soldiers deal with the TBI. If a CO notices a soldier showing symptoms of a TBI, the commanding officer will refer a soldier to a hospital for a psychological evaluation. The psychological evaluation will let the doctor know whether or not the soldier has a TBI, and this method is effective in identifying the TBI but not treating it. Also, there is one major flaw, and that is if the CO does not catch the TBI symptoms and the soldier is not referred to a hospital. Reintroduction to the soldier's family is probably one of the most controversial methods of treating a TBI. The main reason this would happen is because a soldier has a mild or moderate TBI, and he or she has not shown changes in aggression. But this is the least effective method of treating TBI because it puts civilians in danger. The military also uses flashcards to help the soldier learn simple math, reading, and writing functions. Although it may be difficult, this has a good track record in helping soldiers deal with a TBI. The next part in understanding my research question is identifying the main causes of a TBI. IED is the weapon of choice that causes the most TBIs because for some reason the TBIs affect the soldier's head. Dr. William Watson of the United States Navy said that they are making improvements in the soldiers' gear, especially their helmets and the soldiers' body armor, to help prevent concussions. The military has also learned that concussion blast from an explosion causes the most TBIs. because the brain is rattling around in the soldier's head. Because of this, there have been many improvements in a soldier's helmet that will prevent a TBI. And Dr. Jeffrey Ling of the United States Army has learned that yoga helps relieve some of the stress of a TBI. He's also learned that yoga helps the soldiers relearn basic motor skills like balance. Ling also uses group therapy and one-on-one to help the soldier with the TBI. This therapy kind of goes like a AA meeting where the soldiers are sitting in a circle. But if the soldiers are from the same unit, and in most cases they are, the soldiers can help each other remember the ordeal and cope with the TBI. And Jeffrey Ling has also discovered that using simulations for the soldiers to help them deal with everyday lives is a very effective method. These simulations include, but are not limited to, brushing teeth, reading a book, chopping food, and opening a door. And finally, there is proof that a TBI can be cured because Phineas Gage was hit with an iron rod when he was loading dynamite into a cave for a railroad with it. And Gage had a TBI, but he died of an illness unrelated to a TBI 12 years later. And in recent events, Gabby Giffords, the representative of Arizona, was shot in the head and recovered from the ordeal, but she has not fully recovered yet. With these two statements from Phineas Gage and research I've done on Gabby Giffords, one can conclude that TBI can be cured by using improvements in today's medical field.